Hey guys, Jasmine here with IPS Learning Institute, helping you to improve the delivery of healthcare by alleviating and solving the mysteries on the business side of healthcare. All right, so what is a billed amount? So we refer to a billed amount as the amount that you as a provider or organization or the employer that you work for would have designated for a particular service. So very simply, it's the fee schedule for the practice or organization. So the insurance company has their own fee schedule, and then the provider organization also has a fee schedule. So this is the amount that you have designated that you would charge if a self-pay patient were to come to you, or when you are sending a claim to any of the insurance companies. So you should only have one fee schedule in your office. So a specific amount designated, a rate for each service that you provide. These fee schedules, or the billed amounts that you're charging for a specific service, is usually something that you want to review on an annual basis. So you might want to raise your rates according to what your contracts are, or how your contracts are adjusting, or just so that you can be able to keep up with inflation. If you found this video helpful, give it a thumbs up. And if you're new here, welcome. Don't forget to subscribe so that you don't miss out on helpful videos that will help further your understanding of the business side of healthcare. We post videos each and every week. Until next time, my friends.